Welcome back, everybody. Dr. Greg Eckel. Today's show is the role of metabolic health in brain health. My guest is Dr. Neetu Sharma, known as the Kidney Whisperer. She's a double board certified kidney specialist and functional medicine expert, dedicated to revolutionizing healthcare by addressing the root causes of chronic diseases, particularly kidney disease and metabolic health issues. With over 15 years of experience, Dr. Sharma combines her expertise in nephrology with functional and holistic approaches, offering personalized wellness programs that empower patients to take proactive steps in their health journey. Dr. Sharma's work is driven by her deep commitment to preventative health care, inspired by witnessing family members endure dialysis. Her approach resonates with midlife professionals facing metabolic challenges, aiming to educate and engage them in sustainable lifestyle changes to prevent disease progression, turning patients into active participants in their healing process. Her passion for patient empowerment, combined with her extensive training in functional medicine and nephrology, has made her a respected voice in the field. Welcome aboard.
Thank you so much, Dr. Eckel, for having me here.
Indeed. I am really, this one is near and dear to my heart, and it sounds like near and dear to yours. I love the moniker, the Kidney Whisperer, and it makes sense if you lived through a family member enduring dialysis. So that was your motivation for getting into medicine.
That is correct. I was only, young kid in the school, middle school, and my uncle was diagnosed with kidney disease. He was suffering from obesity, metabolic syndrome, developed diabetes, and diabetes actually led to the kidney failure, and he ended up on dialysis. So I have witnessed very closely how these patients, go through the progression of the kidney disease, and when they end up on dialysis, it's not only the toll on the patient but also the toll on the entire family. It's a life altering disease, and later on, when I got married to my wonderful husband, his mom was also on dialysis, and she passed away because of the complications related to it. So
Wow.
I have witnessed it very closely, and that was my motivation to get into medicine and to become a nephrologist to help those patients.
Wow. And by getting the moniker, the Kidney Whisperer, my guess is you're able to prevent and also help folks perhaps reverse out of these conditions. For those the folks listening, viewing that don't know what the process of dialysis looks like, can you explain that to us?
Yeah, so when you have a kidney disease, it doesn't occur in a day or two. It takes weeks and months to occur, and many people, they are walking with the kidney disease. They don't even realize they have one unless they get certain biomarkers checked, certain labs done in their doctor's office, and they get the news, okay, you have a kidney disease now. And there are different stages of kidney disease. Stage one is, almost more than 90% of kidney function. And stage two is when you have kidney function of 60 to 90. It's the filtration rate we look at on your blood work, and that tells us how much your kidneys are functioning. Stage four is when you have kidney function of 15 to 30, and stage five, less than 15%, when people start having more problems, complications, and end up on dialysis.
Hmm.
And when you are on dialysis, basically, your kidneys are not functioning, and they play a very important role in your body. They filter out all the toxins from your body, and when that doesn't happen, you will start accumulating those toxins. So dialysis machine actually takes over the role of the kidney, clean up your blood, take the blood out slowly at a moment, clean it up through the filter, and put it back into your body. So they are actually functioning like a kidney. Kidneys are functioning 24/7. We all know that. But the dialysis, at the minimum, the research and all the publications showed should be done at 4 hours every other day, 3 or 4 times a week. So, imagine you're sitting on a dialysis chair for 4 hours a day, and after that, you have no energy left to do anything. And that's what the life of these patients are. So their
Mm.
life is in the dialysis unit, and they are otherwise sleeping at their home because they have no energy left.
Yeah,
Yes.
so it's pretty devastating and quite depressing, one, to go through it, and then two, for the whole family around that individual. Like, wow. So, oftentimes, as we hear on our show, it's the personal tragedy and story that is the motivation to create the change and be the change in the world. So, kudos to you for really following through with your dream and your motivation and your significant body of work here. What leads, you said it doesn't happen overnight. So, um, what leads up to, what are the preconditions or pre-states of being that have to be present for the kidneys to be affected like that?
Yeah, there are actually many factors. Kidneys, they are a very sensitive organ, and they are so sensitive that whatever goes on in your body in terms of your heart, stress, metabolic syndrome, high cholesterol, your gut is not right, everything affects your kidney. And when that starts occurring, over the period of time, when there's a lot of inflammation, it can cause scarring in the kidney and lead to kidney failure.
Mm.
And that's when people develop that kidney disease. So, there are many, many factors which are responsible for that. And begin with, we all know there is an epidemic of obesity going on right now. And we know that 40% of adult Americans are obese. And obesity metabolic syndrome is the first thing which can lead to the next cascade of other things like prediabetes, diabetes, cardiovascular disease, and that lead to further kidney failure over the period of time. And we have seen, like in my practice, I have seen other causes too, including, taking over the counter pain medications like NSAIDs. And many people, when they start abusing those medications, they can also lead to kidney problems. And usually those problems are reversible in most of the cases, but we have seen some cases where they are irreversible, leading to chronic kidney disease. There are certain, antibiotics. So in acute hospitalized patients, if they are given certain antibiotics like vancomycin, that is also linked with the kidney injury, but those are usually reversible causes.
Mm. You mentioned, I mean, that's a long laundry list. And, we're talking on kidney health as it relates to brain health as well, and the metabolic conditions. And we're hearing a lot more about metabolic syndrome and the obesity epidemic. You mentioned 40% of adults in the United States are obese. Um, and then and how the kidney plays a role of getting damage with diabetes and insulin resistant inflammation, all of those things affecting kidney, the kind of the delicate filtration system. The kidneys in filtering out waste products. Well, our bodies are amazing recyclers, right? So if you don't get it out through your urine, you're recycling those toxins back to the brain. Will you speak into that a bit on the metabolic syndrome, that cascade that you went through, um, how that works physiologically in the body? How do you explain that to your patients if they're concerned with neurodegeneration, maybe Alzheimer's, dementia? They've seen their parents go through it. What are the things that they need to be watching out for themselves?
Yeah, so that's a very good question. All the time I have seen that patients, when they are getting overweight, getting metabolic syndrome, they really feel fine, and they don't pay attention to those small signs which are happening in their body. And by the time they realize that, things are going out of control, it's already too late. Because even diabetes, it doesn't happen in a day or two. It takes weeks and months and years beforehand for those cellular changes occurring in the body. And metabolic syndrome is, it's a term which we use when you have excessive weight, you have high cholesterol, your blood pressure is high, and you are prone to get diabetes. So that is basically concise it into metabolic syndrome. And when that happened, that most commonly we see in our day-to-day practice, that your blood sugar will start fluctuating. And when you have high blood sugar levels, that itself disrupts the brain cells, right? So it causes inflammation, it causes release of various cytokines. When there is excessive fat on your body, the fat cells release the inflammatory markers called adipokines, and that causes inflammation at the neuron level as well. And, we have seen these patients having insulin resistance throughout the body. We never thought insulin resistance will affect the brain as well, but the research has shown insulin resistance occur at the neuron level too. And what it does is it causes the inflammation at the cellular level. It also damages the neurotransmitter in the brain. So that affects your memory, your cognition, and causes neurodegenerative diseases like Alzheimer's and dementia, which is very commonly found in patients who have, diabetes, who are elderly, or they have kidney disease. And not only that, there are many other factors which are responsible for cognitive decline in these patients, including cholesterol. We know that, is only 2% of your body mass, but it's 20% of body energy the brain is using, and the 25% of your cholesterol is actually in the brain cells. And that's the function they are doing at the local level in your brain to, maintain those neurotransmitters, maintain a healthy neurons and healthy brain cells, and that helps with the cognition. So when there is disruption of the cholesterol itself, high, triglycerides and low HDL and high LDL, and not only that, oxidative LDL, which is even more inflammatory, that causes the plaque formation in the small brain vessels. Those are the blood vessels which are supplying the oxygen and the blood flow to your brain. And when the plaques happen, then there will be decreased blood flow, decreased oxygen, and that causes the ischemia at the local level, which means there's decreased blood flow and it causes the damage to your brain cells. And that leads to cognitive decline over the period of time as well. And, we have papers showing that if you are obese, then those people, they have their brain actually shrink. The
Mm.
hippocampus is smaller as compared to the person with a normal BMI. So it's a well-studied phenomena and often ignored phenomena. We are not well versed, like in my conventional practice for the last 15 years. You have only so much time with the patients, right? You're spending like 5, 10 minutes. Where would you get that time to educate them about these things so that they are proactively looking for that? And it's impossible in the in the conventional medicine, and that's the reason I incorporated functional medicine into my approach so that I can help and impact these patients at the greater level.
Oh, I love it. And thank you for that really eloquent and concise description of the pathway that is happening there. That was beautiful. Thank you. The, that aspect, and, go back and listen to that, folks, because that pathway that Dr. Sharma just went through is exactly what's happening. We've got a lot of folks tuning into this podcast the Brain Regen podcast on how do they improve brain function. And we like to think in the West we can walk around in our gray matter of our brains and we're not attached to our body. But guess what? This is such a big deal with the insulin resistance and the obesity component and leading to the inflammation. And you have inflammation in your body, you're going to have inflammation in your brain, just as you went through there. Now, give us the good news, Dr. Sharma, because that is dismal, right? What
Yeah.
can we do about it? What can we do about it?
Actually, there are very simple steps we can take on a day-to-day basis. And, those steps should be taken at early on when you are in your 30s, your 40s, in your midlife, not when you are, old and fragile and you have all the chronic diseases. So I approach proactively in my practice to tackle these problems early on before even they arrive. So, preventative care is very important. There are simple steps you can take to prevent this cognitive decline by, there's a gut brain connection. We all know that. And many patients who are obese, they have dysbiosis, which is the disruption of the healthy gut bacteria. And when that happens, then there is a term which we use, leaky gut, which means simply there are connections in between the cells in your gut. And when you have leaky gut, those connections are not there. And, the toxins from the gut get released into your blood. And when that happens, it causes the brain damage, cognitive decline, memory decline, and other neurodegenerative changes. So the simple thing you can do is to take prebiotic and probiotics to
Mm,
help the gut microbiome. When you have healthy gut, then it decreases the inflammation in your body and it actually impacts your brain as well. And the gut is we consider gut as a second brain. There is a reason for that because gut has its own nervous system. It is called enteric nervous system. So we have to make sure that we have a good healthy combination of bacteria in our gut producing those small chain fatty acids and other important amino acids which are important for the brain function.
mm,
And everything from your cell membranes to the neurotransmitters, everything depend on those small amino acids. And if you're not producing the right amount of amino acids and you don't have the good gut bacteria, it leads to the cognitive decline. And the second simple thing you can do is the physical activity. And research has shown that, regular physical activity, it actually promotes the formation of a transmitter called brain-derived neurotrophic protein. And when that happens, it actually makes your brain cells grow and it helps with the neuroplasticity. It's a term which we use when the neurons are making new connections. It helps with the learning and memory. So
mm.
those simple steps, every day, incorporate 20-minute walk a day and have, probiotics in the form of yogurt, kefir, kimchi, if you like it, add some flavor, but get your gut under check and have the physical activity.
Awesome. Do you like to do microbiome testing, or you just feel like, look, if you've got metabolic syndrome, we know you have gut dysbiosis? What's your thoughts on that?
So most of these patients, they have gut dysbiosis. We know that. The obesity is directly linked with depression as well.
Mm,
And that is also the reason it starts from your gut, because gut microbiome, it releases the feel good hormone called serotonin and dopamine. And when you have dysbiosis, then these patients, they tend to have more anxiety, more depression. And most of the cases they have, we look for other symptoms as well. Of course, if you are constipated, you're bloating, you're reacting to certain food, that tells us your gut is not working right. So everything starts from that. And by giving them proper prebiotic and probiotic supplements and getting the gut under check, I think that's the first step we take to help prevent those cognitive decline.
Mm, love it. And do you notice, I know that you had mentioned that you just you launched a wellness program for weight loss because that is really a big component as to what's going on with metabolic syndrome. And so helping people rather than just doing peptides or drugs, it's more of a lifestyle based program. How do you get results with that? How do you,
Yeah.
yeah,
So, my program is different from there are so many weight loss programs out there, right? So, the difference is that I am putting the functional medicine approach with my conventional knowledge into the medicine. So it's not just the meal plan or just, the exercise. I don't teach exercise. This is actually a no exercise program where you can lose 15 to 50 pounds in 10 weeks,
wow.
and that's based on we do the comprehensive biomarker analysis because everybody is different, their environment is different, their stress level is different, their hormones are different, they're eating differently. So everything is taken into account to make that protocol specific for the need of that particular patient. And when we know the root cause, that why you are gaining weight, whether is it related to your thyroid, is it related to your dysbiosis in the gut, or is it related to your stress, or you're just not eating right, we do give the meal plans, and which is comprised of the phytonutrients, and we give the support with the right supplements, with the right protocol. And I have a proprietary homeopathic reset spray, which helps regulate the hormones and your hypothalamic, pituitary, adrenal axis. They normalize that. And we also, give them the guidance about how to sleep right, how to get their stress under control, how
Yeah.
to shift from sympathetic to parasympathetic state. And those all conditions combined together will give you the results which are sustainable. It's not just the calorie count which matters, but the whole lifestyle change matters for the sustainable results.
I love it. Yeah. So you're making it a sustainable lifestyle rather than a specific diet or intervention, right? It's got to be there
Correct.
all the time because, is this true? There's a set point that the body will hit, even in obesity, that it has these memory that it can, it's like we see a lot of people that will do yo-yo dieting and sometimes even gain more weight than before they went on an intervention or a diet. Is that true?
Yeah, yeah, that is true actually. And it's very frustrating not only for the patients, but for the people who are running those programs too, because, it's actually not your willpower. I believe that it's your environment. So if you are setting your environment right, if your pantry is full of fresh produce, whole food, olive oil, omega-3, avocados, and things like that, rather than junk food, with then you're setting up your environment for success, and you have a support, you have a community around you. And through this program, I'm making sure that I'm there for them, for my patients. I'm conducting weekly live calls to support them, answer any questions they have. So it's a lifelong process. And with that kind of motivation, I think that's why I'm seeing the more sustainable results in my practice.
Got it. That's awesome. Because it is, it's so easy to say, but it's so hard to make it stick, right?
That is
And to
correct.
actually carry through. So, I think, massive component for brain health. This is a piece that we qualify people for coming out for our brain camp. Um, Around if they have uncontrolled sugars, we don't invite them to our camp because it is so inflammatory for the brain and leading into neuroinflammation, which will then drive their degradation and neurodegeneration. And, the non-sexy things like the exercise, like the sleep, but so crucial for as foundation for health. What for movement, you mentioned you should get out and walk. Do you have some guidelines for people for movement?
It depends. Everybody is different. As I said, like your response to the exercise and what kind of exercise would be different from my response to the exercise. And sometimes, genetics plays a role, and we know that certain genes, we can, by looking at all those genes, we can say, okay, maybe high intensity interval workout would be best for you, or maybe a strengthening exercises will be best for you. But the bottom line is, whatever you do, you have to listen to your body, and I don't want you to do anything extraneous, strenuous exercises, or go all the way out, but maybe incorporating just the simple walks during the daytime. 10-15 minutes interval walks would have a beneficial effect, and you don't have to walk for 2 hours, 1 hour. Doing some kind of weights and strength training will always help your muscles, and we know that muscles are linked with better cognitive health and longevity.
Mhm.
So those are my recommendations. So take care of your muscles, and put on some tennis shoes and go for a walk.
I love it. I love it. Any last parting words that you would like to share with our listeners and viewers, Dr. Sharma?
I think the self-care starts early on, and I want the patients to be proactively involved in their own health. Ask questions when you see something unusual on your lab test. Get your physical done, get your initial biomarkers done, which tells you how your cholesterol is, how your kidney function is, and how your weight is. In many of the medical practices, they calculate your height and weight, and that gives you BMI. So start from that, like the basic stuff, and be mindful about the changes you are seeing in your lab test or in your body. Listen to your body. It's funny because when I launched this program, I have done this program myself. I was my own guinea pig, and I lost 18 pounds. And not only that, my brain fog was gone. I got my energy back. My cholesterol was down, which was not the case for many, many months. And then I had a patient who reversed his fatty liver only after 8 weeks in the program. So it all starts from your mindfulness, your active participation in this program, so that they can help themselves. And I'm there to mentor them, to help them.
I love it. Well, thank you so much for coming on the show. Folks, if you got something out of today's show, give us a 5-star review. Tell people what you're taking out of this conversation. Metabolic health and brain health are intricately linked. Dr. Sharna, thank you so much for your beautiful way of explaining how the body works and the lovely work that you're doing out there. Thanks.
Thank you so much. It was my pleasure.